Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, Stephanie Desmon talks to Johns Hopkins researcher Dr. Elizabeth Stuart about her recent work on understanding pandemic learning loss and what can be done now to help children who have fallen behind. Let's listen. Elizabeth Stuart, thanks so much for joining me.
It's great to be here with you.
So before we launch in, I did want to congratulate you on your new appointment at the Johns Hopkins Bloomberg School of Public Health. You are now the chair of the Department of Biostatistics. So congratulations on that.
Thank you so much. It's been a fun change.
Yeah. Today, I want to talk about learning loss during the pandemic. I know you recently did some research with some others on what that looked like and where we go from here. And this is such an important topic for anyone with children and really, frankly, everyone, because I think this could have long-term impacts on the economy. So talk to me about what the learning loss looked like.
Yeah, thank you for focusing on this topic. As you said, I think it's something that's going to go well beyond like the school environment, and we really need to be grappling with it more broadly. I first want to recognize the team that I worked on with this. So I was led as part of this educational opportunity project led by Tom Kane at Harvard and Sean Reardon at Stanford. And so it was really a big effort to bring together a whole diverse set of data to better understand learning loss during the pandemic, both in terms of documenting the amount of learning loss, but then also looking at a broader set of kind of predictors of that than had been looked at by other groups. So we are not the first to show learning loss. This is known that kids during the pandemic have lost ground in terms of their academic learning during elementary, middle, high school. The data we had, I think, was broader across the country. It covered about 26 million elementary and middle school students. It's about 80% of public school, elementary, middle school kids in the US. So basically, if we think about overall, it was about half a year of learning loss for the average kid by spring of 2022. So in a few months, we'll have data from the most recent academic year, but this was from the school year ending in 2022. And kids had lost about half a year in math and a third of a year in reading. What was really striking, though, in what we found was this varied a lot across districts. And so we found that in the poorest districts, the kids lost about 3/4 of a year in math. So over the 3-ish years of the pandemic, 2 years really, they had lost about 3/4 of a year in math. This was about double the decline in richer districts. So that was really striking. And one of the things that the work has really been trying to highlight is this, it wasn't evenly distributed around the country. And that in richer districts, there was some loss, but not nearly as severe as in the poorer districts.
You had an interesting finding, though, within districts, didn't you?
Yeah, thanks for asking about that. That was going to be the next thing I would want to highlight on myself. What was really interesting was that although we saw these differences across districts, within districts, the learning loss was actually fairly consistent across different types of kids. So whether it was rich and poor kids within a district, white, Black, or Hispanic students within a district, the learning losses were really pretty similar. So what this was showing us, or what seems to be showing, is that it was sort of more about the circumstances in the district and the community, not just in the schools, but in the broader community, that really contributed to this learning loss. And it wasn't so much about individual sort of characteristics of what was happening. So I think this also then helps point towards what we need to be doing moving forward and thinking about district and community interventions.
So tell me a little bit more about that.
This is a problem. We're going to have substantial investments in trying to help kids get caught up. This is sort of obvious, but it's not like pre-pandemic, kids were just sitting around in school with plenty of free time. And so if we want to think about how to jumpstart kids and get them back towards the trajectories that they might have been on before, we have to think really creatively and outside the box in terms of it's probably not just going to be a matter of different curricula or within the normal models. What a lot of districts are moving to, and I think where a lot of the education research is showing, is that what really is going to make the difference is things like high impact tutoring, whether it's after school programs or maybe summer programs, more investment in basically out of school time, where kids are just increasing the amount of time that they're spending on academic activities. There's going to be pros and cons of that, of course. But I think it's just realistically, it's going to be hard for this ground to be made up during the school day using our normal school processes. Again, I think thinking more about small group tutoring, after school, summer, taking advantage of those sorts of things.
So this is a real challenge.
It is. And I think what is also really important to remember is it's a challenge academically, but we have to remember that these kids have other parts of their lives too. And that partly this work was really meaningful because I'm an education and public health researcher, but also a parent. So I have a kid in middle school and a kid in high school, and I'm pretty involved in our local school communities. One thing that the teachers and principals really reiterate is these kids also need behavioral support still. They are honestly still getting used to being back in school buildings again and behavior. And I think we want to figure out ways where we can support the students academically and with these sort of behavioral and social situations as well. And in reality, they're going to engage more with the academic material probably if they feel connected, if they feel safe, if they feel they're in an environment that is really helping them thrive. So I think it's yes, and where we need to be thinking about the academics and these other more behavioral and social factors.
Now, we haven't had anything like this in modern history. Is there any thought to how quickly districts and kids, more importantly, can rebound from this?
It's a really good question. And you're right. We don't really know. There's clearly nothing, especially nothing at this scale. If you even just think, okay, if kids lost 3/4 of a year, even if you did all hands on deck, if they gained back, 1/4 of a year per year, that's going to be about 3 years. And honestly, gaining back 1/4 of a year on top of their normal instruction, that's ambitious. And so I think we're talking about years. And there are some out of the box thinking about, maybe some school districts should be offering a 5th year of high school. I think we really need to be thinking quite long term about this and not assume that this is something that within 2 years, we're going to be just fully back on track.
I'm just trying to think about how much money this would all cost to bring people back, to do an extra year of high school, to do tutoring, to do summer programs. I'm curious how big that is as an obstacle and what are the other obstacles?
Yeah, of course, funding is going to be a major obstacle. And that's partly why I think it's really great to have conversations like this to sort of raise awareness. And also, I think having the empirical data to show really where we are, and we will be able to track that in the coming years. Again, the empirical data to sort of track to help motivate potential spending needs. Certainly, this is a big investment. And it is happening already. So districts, partly through the pandemic federal relief, there is some funding for things like high impact tutoring and other resources like that. But I think the key is that this is going to have to be sustained. So it's the federal funding was the past few years. This is something that's going to have to really get sustained over time, given that it's going to take time to catch up. I think there's some pieces too where we can be thoughtful about how to spend our resources most efficiently or best for these purposes. There are some online tools that might provide some support, maybe at not huge additional cost. And then also Boston has some initiatives where they're partnering with summer camps to add a little bit more academic instruction to a typical summer camp schedule. And of course, we want to give kids a chance to be kids and to learn to swim and to do all of that, but maybe looking for these opportunities to add like a little boost here and there. And especially if we could do that consistently over a summer camp period, an hour or two within that camp day might make actually a difference long term. So I think people are also trying creative strategies like that. And hopefully we can be learning more and more from those initiatives.
So in the data, did it matter how long a school was closed in terms of the loss?
So one of the things that we've spent a lot of effort on was collecting a very broad set of community level variables to help predict this learning loss, to understand the characteristics of school districts and their communities that experienced greater versus lesser loss. Certainly, one of the factors that came out in that was whether schools were closed, how long schools were closed to in-person learning. But we also saw a number of other kind of community level factors. And again, we were looking at a whole broad set of things. But the other things that emerged were the COVID death rate, also the depression and anxiety among adults in those communities, and some measures of how much daily routines were disrupted. How much were people going about their normal activities, pre-pandemic normal activities? Again, this is signaling that it's not just about what happens in the school during the school day. These kids are in communities where they're experiencing deaths of loved ones, their families were stressed. Even if they were in school, their brains might not have been ready to really be learning. It was just a time of a lot of trauma and stress. So the school closure was a piece of it, but then also some of these other community factors.
And I also recall something about access to Wi-Fi and those sorts of things as being an impact.
This was one of the things where we were hoping to get better data on things like staffing in schools or just resources to get a sense. And we didn't have great measures of that at this national level. That's something that tends to be a little bit more localized. But I think that will be important to try to study further over time to better understand. And I think especially in the coming years, as we start to perhaps have data on what schools have been doing for the past year or two, we can better understand, okay, the ones that hired more teachers, implemented tutoring, did we start to see a faster return to trajectories?
So as a public health person and someone interested in education, I have to ask the question, was it a mistake to close schools?
It's such an important question. And I would say no, in the sense that it was a tough situation and no one really knows. You make decisions at the time and based on the public health and the educational needs. I was at the time happy. Now, this was a couple of years ago, really rewarding to work on a study where we looked at COVID risk associated with in-person schooling. Because I think one of the things that was really hard, and we have to remember, is that there was very little data on these questions. As these decisions were being made, we didn't really know for sure what the COVID spread impacts or what the academic impacts would be. And I think that's partly then why we saw different decisions being made, is that there was tough decisions and different communities might weigh things differently. And so they made the decision that felt right at the time. Looking back, the COVID work we had done on COVID spread in schools, which I think we talked about on this podcast years ago, we showed that spread of COVID did increase in schools that were open to in-person learning, but that if there were mitigation strategies in place, like masking and testing and some other mitigation approaches, that risk was brought back down. And so it was a message of, if schools opened, yes, there was increased spread of COVID, but they could be opened safely. So I hope we're not in this sort of situation again, but hopefully moving forward, we'll have more empirical data to help inform these really tough policy choices.
So where do we go from here?
Yeah, I think about this a lot as a parent and as you said, public health and education researcher. I think we just need to make sure that this stays on top of people's agenda. And again, I really appreciate you focusing on this today, because we have to make sure that these kids don't get forgotten and that we don't assume that, okay, it's been 3 or 4 years and isn't it all fine now? We're all back to our normal routines. But I think we really need to be vigilant to keep tracking this. There is annual testing that will be done across schools. So continuing to track and learn and invest as needed in these kids, because that's really what's going to help us long term. So just keeping this a topic of conversation and work will be really important in the future, not just today.
Liz Stuart, thanks so much for joining me.
Thank you. It's great to be here.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Holly Cardinell, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.